We're talking about cholangiocarcinoma. So cholangiocarcinoma is carcinoma of the bile ducts and or of the gallbladder. So cholangiocarcinoma, is cancer of the gallbladder with associated cancer of the biliary ducts. So cholangiocarcinoma often presents as a patient who has weight loss, which is a constitutional sign of cancer, and painless jaundice. So 90% of patients with cholangiocarcinoma present with painless jaundice. They even often have skin itching, yellowing of the skin, sclera. So they have this painless jaundice. Notice that they also have no abdominal pain at this stage. So the main presentation is just a painless jaundice and weight loss. So they have weight loss, anorexia, maybe even a reduced appetite. Cholangiocarcinoma is associated with PSC, which is primary sclerosing cholangitis. So this is this tree, and the bigger the tree gets, reminds you of the bigger a palpable gallbladder may get. Now, the bigger that it gets, it's more so associated with cholangiocarcinoma. And there's birds which are pea birds, so that reminds you of PSC, which is primary sclerosing cholangitis. Now, a palpable gallbladder, which is the palpable tree, in the setting of jaundice or painless jaundice is called Courvoisier sign, this sign. And the Courvoisier law is actually when you say that the palpable gallbladder, enlarged gallbladder with jaundice is highly suspicious for gallbladder cancer, for cholangiocarcinoma or gallbladder cancer. So another risk factor is a porcelain gallbladder. So a porcelain gallbladder is an absolutely calcified gallbladder, as you can see on this X-ray. So a calcified gallbladder, which can occur due to chronic recurrent episodes of cholecystitis. So recurrent episodes of cholecystitis and recurrent stones within the gallbladder. Look at this gallbladder with stones. If you get episodes of recurrent gallstones and recurrent damage, that's obviously going to cause inflammatory changes, which are then going to result in permanent scarring of the gallbladder. And this scarring of the gallbladder, and a shrunken, scarred gallbladder, is known as a porcelain gallbladder. And this, we often do give a prophylactic cholecystectomy. So we prophylactically take out this gallbladder because we know it's got such a high risk association with gallbladder cancer. So often this painless jaundice and weight loss patient will present late. It's usually a late presentation and it's got a poor prognosis, so the 5-year survival is very low for these patients with gallbladder cancer. We already talked about how it's associated risk with PSC, primary sclerosing cholangitis, but it's also, so this patient has an earring which is made of porcelain, so it's risk with associated with porcelain gallbladder. He's also got inflamed bowel syndrome. So inflammatory bowel diseases like ulcerative colitis are again associated with this condition. So ulcerative colitis and PSC are both diseases that occur along with this condition and increase the predisposition these patients have. In terms of treatment, we do an excision. So we do an excision, which is typically we excise typically the whole gallbladder, and whether or not we excise parts of the liver depend on whether or not the cholangiocarcinoma, whether or not any of it is intrahepatic or not. Is any of the cancer intrahepatic? If it's not, then we typically just excise the gallbladder itself. And that's everything for gallbladder cancer.